Welcome to Ask an MS Expert Veterans Program. My name is Emily Riley, and I am the moderator for this wonderful program. I am a proud Air Force wife, dog mom, certified personal trainer who teaches adaptive fitness classes for the MS community, and I have been living with MS for over 18 years. I am currently located at Scott Air Force Base. Thank you for joining us. The National MS Society is committed to offering a place to connect and ask questions to MS experts on topics impacting veterans affected by MS. MS navigators are online throughout the program answering questions and providing resources, so please post any questions or comments that you may have in the comments box on Facebook, YouTube, or Twitch. I'd like to acknowledge and thank today's national sponsor, Lockheed Martin. Support from MS community partners helps the National MS Society reach our goal of providing up-to-date information and support through programs like Ask an MS Expert Veterans Program. Now, people with MS may find that bladder and bowel symptoms interfere with their participation in daily activities like work and recreation, but it doesn't need to be that way. Once diagnosed, these common MS symptoms are manageable, and most people find that they can return to the activities they enjoy. Joining me today to talk about how to manage bladder and bowel issues is Dr. Carol Gibson-Gill. Dr. Gill is a medical director with expertise in MS, spinal cord injury, and ALS care. She has spent her whole medical career providing healthcare to veterans living with multiple sclerosis, spinal cord injury and disorders, and ALS, while supporting their family caregivers. She serves as chief of the Spinal Cord Injury and Disorders Department at the VA New Jersey Healthcare System. She also serves as the director of the VHA Multiple Sclerosis Center of Excellence New Jersey Regional Hub and is an MS multiple sclerosis specialist. I'd like to ask Dr. Gill to join me on camera. Thanks so much for being here today. Awesome.
Thank you.
So bladder and bowel issues can be an uncomfortable, embarrassing topic to talk about, but it's important to discuss with your healthcare team. So Dr. Gill, why is it so important to discuss these symptoms with your care team?
Well, this is such an important topic, and I'm so glad you asked that question, Emily. Health complications can arise from bowel and bladder care not being managed properly. So it's important for us to avoid negative impact on quality of life, negative impact on our patients' health, as well as avoid them from having embarrassing situations that can really affect them emotionally, mentally, and even cause some social isolation.
Right. So what kind of risks do people face when they don't address their bowel and bladder issues?
Okay, so I'll start with the bladder.
Okay.
Basically, if your bladder issues are not managed properly, you really are at risk for multiple issues. And I'm going to start with bladder infections, even kidney infections, kidney stones, and really even kidney failure, because if your kidneys continue to be attacked because of improper emptying, it can really lead to renal failure, kidney failure. Bowel issues can cause a lot of complications. It can cause bloating. It can cause some leakage. It can lead to severe constipation, severe obstipation. It can lead to even your stool backing up. It can also have a lot of impact on you just not being able to eat well, not being able to sleep well, and your spasticity can be increased by both improperly managed bowel and improperly managed bladder function.
Wow. Yeah, it's so interesting that approximately 80% of people with MS experience bladder problems, but we know that healthy bladder is important to your overall health and quality of life, sort of like what you mentioned earlier. So what does cause bladder dysfunction in MS?
Okay, so basically, bladder function is very, very complex. We don't take that into consideration, or we don't know how complex it is to urinate. So basically, your bladder management, your bladder function is controlled by your the bladder, collecting the urine, your spinal cord, and your brain. And there has to be a flow of communication between those three areas in order for us to have a proper emptying. When you have a multiple sclerosis lesions that attack the spinal cord, it disrupts the pathway. It disrupts this flow of information from top to bottom, bottom to top. And what happens is, depending on what part of your bladder is being affected, you have different kinds of problems. So that is key to understanding how MS can impact your bladder function.
Okay.
So sometimes where the lesion is can cause your bladder to be overly active. So what happens is you feel like you always have to go. Your bladder is being told to contract, contract, contract. And then sometimes your bladder is just relaxed. It's just not doing anything. It's just sitting there, and your kidneys are dumping urine into your bladder, and your bladder is just receiving it, but it doesn't get the message that, hey, it's time to let that urine out. So that can cause problems.
Yeah. So Manuel had said that he'd heard that there are two types of bladder issues. One has to do with storing urine and one has to do with emptying your bladder. Can you describe both of those issues in a little bit more depth for us?
Yes. So storage, the issue of storage. So the way the bladder works is, the kidneys make the urine and they dump the urine into the bladder. And the way the bladder is designed to work is that when you get a certain volume of urine in the bladder sends a trigger, it sends a sensation up to through your spinal cord to your brain to say, hey, I need to be emptied. Mm-hmm. And then you have the control to say, okay, I can go to the bathroom right now, or I'm too far from a bathroom. I have to hold it until I can get to a bathroom. Now, when you have MS lesions disrupting the process, this flow that I just described, mm-hmm. you can have a situation where your bladder is overly active. So what happens is, as soon as the kidneys dump the urine into the bladder feels like it has to empty. That's mm-hmm. overactive. So you have to run. So you get that urgency, you get that frequency, you get that running to the bathroom all the time. And you go and just a little bit of urine comes out, right? Because the bladder tells you, you feel like I've got to go. That's an overactive bladder. Then you have the other bladder situation where the bladder is just relaxed and it's just hanging onto the urine. And the kidneys are just pouring urine into the bladder. And it's just pouring and it's just pouring. And the bladder mouth, the sphincter, mm-hmm. is not relaxing for this urine to come out. And so it's just sitting there. And that can lead to problems for your bladder as well. And then you have the scenario where, unfortunately, you may have both. You may have the bladder just, feel like it has to empty. Okay, it's overactive. And then you have the sphincter, the mouth of the bladder, not relaxing to let the urine out. So that can cause a problem as well.
Wow. Sounds like it can be a little complicated and also impact people's lives in various ways, whether you're like vacationing or out to dinner or whatever. So that can be really challenging. Mm-hmm. So what are some of the most common symptoms that people maybe should be aware of that are signs of potential bladder dysfunction?
Okay. Well, I encourage my patients to really pay attention to the body. We really need you to pay attention, because sometimes it could be as simple as waking up multiple times at night to go to the bathroom. Sometimes it's, you used to be able to hold your urine from the time you got in your car to go home. And now you have to stop to the nearest store or the nearest restaurant to urinate. So you have that frequency, you have that urgency where you have to go, I must go right now. Sometimes, unfortunately, you have leakage where you wet yourself, which unexpectedly you have accidents. So those are some things that I really want you to look at. Or you try to go to urinate and the urine is not coming out. You have hesitancy. Mm-hmm. So any change where you're running too much, you peeing too frequently, your bladder is not relaxing and letting the urine flow, you can't hold your urine, you're waking up multiple times during the night, and you are leaking, you're having some accidents, those are things that we want you to pay attention to.
For sure. Yeah. And these topics tend to be somewhat embarrassing to talk about, but it sounds like it's really important to keep those lines of communication open with your provider, because I feel like it's like a domino effect. If, you start getting UTIs, then that just affects MS even more so.
Yes, absolutely. Because when you don't empty your urine as you should, you can start getting urinary tract infections. And we want you to really pay attention to that. How many urinary tract infections have I had this year? You
Yeah.
know, and that's something that you need to talk to your provider about. So those are signs. That's another sign that something is not right, something is unusual for you.
Yeah. Well, and then as we kind of shift into like bowel problems, about 70% of people with MS experience bowel problems, and that can cause a great deal of discomfort along with embarrassment. So, what can cause bowel problems in MS?
All right. So once again, your bowels are, people don't realize it, but our bowels really, they are controlled locally by some small nerves within your intestinal tract. But also, once again, the connection between your brain and your spinal cord, right? You feel like you have to go to the bathroom before you have MS lesions affecting your spinal cord. You hold it until you get to where you have to go, and then you move your bowels. When you have impaired bowel function due to multiple sclerosis, you have a problem where sometimes you have to go right away. You have the urgency where your bowels have to be empty, like now. You can't wait to get to where you have to go. Sometimes you have constipation. Sometimes you only move your bowels 2 times a week. When before your MS diagnosis, you were going 4 or 5 times a week. Sometimes you even have embarrassing leakage, where because the stool has sat in your intestine so long, in your large intestine so long, that the stool becomes hard, and the new food that you eat that gets digested is all liquid. And by the time it comes down to your large intestine where stool is stored, it's not able to be absorbed for the water to come out of it. And so you get what's called leakage. I always tell the patients, imagine pebbles in a stream. The water will find a way around the pebbles, and that's what's happening. So the old stool is sitting there and is causing the new stool not to be able to get dried, so that way it doesn't get formed. And so you will have leakage because you're not able to manage your bowel properly. You may have the sphincter will be weak because the MS has affected the control of your anal sphincter, right? That keeps stool in your tract without accidents. You may also have poor sensation. You don't feel, so the connection is not there because you can't feel that you full, that area is full and it's time to empty. So different things along the pathway can affect your bowel emptying, your bowel function.
So, what are some of the most like common symptoms of bowel problems?
Very often we hear patients talk about constipation, not moving, they're eating and nothing's coming out. And so that's when they will talk about it. Listen, I'm not moving my bowels. Sometimes they may not talk about it, but it's up to the doctors to ask those questions. Sometimes they will have frequency, or they may say, I have diarrhea. I keep getting diarrhea. I've had diarrhea for a whole week. And it's really not diarrhea. It's really because the constipation is so bad that the recent foods they're eating is coming out soft because it hasn't gotten a chance to really be absorbed properly due to the blockage. And sometimes I've had patients really have to go to the emergency room because they're so backed up, they're throwing up. They're not able to eat well. They feel full quickly. And so those are some symptoms to look for. And something that's very embarrassing is leakage. Someone will say, listen, I went to make to pass gas and all this stuff came out. Or, I was laughing at my friends at dinner and this stuff came out. So that's something that is important to pay attention to.
Yeah, for sure. So let's talk a little bit about maybe solutions on how to manage these issues and resources that'll be helpful for veterans living with MS. So you mentioned a little bit about maybe diet. So like, what are some lifestyle modifications that people can make to help manage their bladder and bowel symptoms?
It's important for our patients living with MS to understand the types of foods and the impact they can have, right? So certain foods for both bowel and bladder, like caffeine. Caffeine can impact, it can impact your bladder. It can cause, irritation in the bladder lining. It can cause you to what's called diuresis, to kind of make your urine come through your system quickly and just come and dump into your bladder. It can cause you to get contraction in your bladder. It does the same thing to the bowels, where it increases contraction of your intestines, and so your stool comes out. So caffeine is important. Spicy foods have similar effect. Alcohol have similar impact, on the bowels. It's like an irritant, it's a stimulant. So it's important for you to understand, like, listen, it's an irritant, it's going to irritate my bowels, it's going to irritate my bladder, so I've got to be careful. Adequate fluid intake for your bladder, you want to make sure you're taking in enough fluids, okay? And if you're taking in enough fluids, you want to make sure that you're emptying. For constipation, for neurogenic bowel, also fluid is important, so that way your stool doesn't get hard and too firm in your intestines. You want to drink enough fluid to come out. Physical activity is very important to help with your bowel management. And what happens is, like, if you it almost kind of like works against you. So if you not emptying your bowels properly, you don't feel well, you sit around, it just makes it worse and worse and worse. So it's important to be physically active. It's important to eat a lot of fiber in your diet to kind of help move things along. If you're going to eat fiber, it's important also taking your fluids. It's important for you to consider doing time voiding, people who have bladder issues. So basically you may want to say, okay, I'm going to just make sure that I am sitting on the toilet to urinate, or I'm going to the bathroom to urinate every so many hours, maybe every 4 hours, to make sure that I'm emptying my bladder properly. And even, sitting on the toilet, sometimes it's important for you to sit your feet flat on the floor. And now actually some people even raise their feet a little bit off the floor on like a platform. And what that does is that helps align your rectum and your descending colon, so that way the stool can fall and drop easily with the assistance with gravity to get your stool into the toilet bowl. So those are some things that you can add some lifestyle modifications you can make to help you manage your bowel and bladder.
That's great. Yeah, I'm all for, non-pharmacological options if that works for people. But let's say we've tried all these things and that doesn't really seem to help. So what are some medical interventions for people who experience bladder and bowel dysfunction, and how does someone know if maybe it's needed?
Yeah, so this is why it's so important to speak with your healthcare worker. It's important for them to understand what's going on with you. And that's why I talked about keeping the line of communication open. So let's just talk about bladder. All right. If a person, if you notice you're having these problems, okay, and your doctor notices that you're having a lot of urinary tract infections, maybe 2 or 3 or 4 a year, that requires antibiotics, or antibiotics, or you feel like you have this hesitancy, you're leaking. So we have to find out what's causing it. Now, is it because you're not storing the bladder properly, the urine properly? Is it because you are not opening your sphincter so that the urine flows when you go to urinate? So the questions that will be asked will help your doctor figure out what pill to give you. Some pills will help relax your bladder wall so that the bladder relaxes and it can receive more urine from the kidneys. When the kidneys are pouring the urine into the bladder is not spasming, it's not contracting, it's relaxed. And so the urine gets dumped into the bladder. And when it gets to a certain pressure, like, 200, 300, then you can urinate. Now, sometimes it could be because your sphincter, your bladder external sphincter is not relaxed. It's not relaxing, even though your kidneys had put enough urine in your bladder and it should relax. So then there are medications we can give you for that. Pills that we can give you that can relax the bladder, neck, the sphincter, so that the urine flows. Sometimes we can do injections to the bladder wall if the pills don't work, to help the bladder wall to relax, and even to the sphincter. So we really encourage you to talk to your provider, because sometimes it would require you seeing a neurourologist who is not a general urologist. It is a urologist who specializes in neurogenic bladder, and they would know how to manage and what kinds of medication and interventions that you need to get beyond the pills your provider will give you. Now, when it comes to the bowel, similarly, we assess what the situation is. If the situation is that you are constipated, we will really go over how you eat, what you eat, what is your schedule, and then we can order medications. We can order you softeners to keep your stool soft. So what that does is that brings in water into your intestine, so that way the stool is soft and you can pass it out. Or we can give you some tablets that can stimulate your intestines to contract and move the bowels out. Okay, sometimes we may have to give you suppositories that you can insert in that can cause a local stimulation, and it can cause the stool that is there to come out. Sometimes if the medicines don't work, we may have to encourage you to go on a bowel regimen, which may involve training and showing you how to go in and empty your bladder. Sometimes for your bowel, sometimes for the bladder, we can teach you how to do intermittent cathing, where you can go in and catheterize yourself. We teach you the technique. You go in with a catheter small like a straw, and you go into your bladder and you drain on a certain interval.
Wow. Sounds like there's a lot of options for people, depending on what they're experiencing.
Yes.
So we had someone, Cameron, their doctor suggested that she start a pelvic floor physical therapy to help her with her bladder problems. What is pelvic floor physical therapy, and could Cameron receive this type of therapy through the VA?
Right. So when you hear pelvic floor therapy, our pelvis, we have muscles down there that keep everything in.
Mm-hmm.
Okay, keep all our intestines, our bladder, and our uterus, and if you're female, everything in. So those muscles are the focus of the therapy.
Okay.
And the goal is to teach you some exercises that you can do. So there are certain stretching, certain strengthening exercises that a physical therapist who has experience with pelvic muscle strengthening exercises will see you and teach you some of these things. And it's sometimes we tell people doing the Kegel to kind of tighten, but there are other things that you can do that you can be taught along with the Kegel exercises that you can do. And so this is where this therapist comes in. And to answer Cameron's question about does the VA have it, yes, speak to your healthcare worker, and the VA will provide for you a person who can help you. Now, if that VA facility doesn't have it, the VA will have a way to facilitate you getting the care that you need.
Great. Wonderful. So as we've kind of talked about, bladder and bowel issues can really impact someone's emotions and their relationships and their socialization. So what are some ways that people can feel confident in managing these symptoms and avoid isolation?
Yeah, I think, and what I've seen in my many years of practice is once the patient really understands how their body is now working with the impact the MS lesions are having on the spinal cord and the communication between the brain, the spinal cord, and the bladder and the bowels. Once they understand how those things can be managed, and they are implementing those things that have been managed to help them manage their bowel and bladder, they don't have the accidents. They have more control of what's happening to the body. They can know how to plan their day. They can know how to plan their activity. They really feel more in control because they are now educated and they know what they can do to empower themselves. And so once you learn that, I've seen that they feel more confident. They're not being embarrassed. They're getting better sleep. They're not waking up multiple times a night to go to the bathroom to urinate. They're not taking antibiotics because of frequent urinary tract infections. They're not backed up. They can eat a decent meal. They don't feel bloated, and they know when they can go to the bathroom to move their bowels. So we see that once they get that control back, based on the understanding and how to apply these things to their lives, that they feel confident and they can get back out there again. They can go to the movies, they can go to dinner, they can go to their friends' parties, they can go to the park, they can do things because they know how they will be able to manage their bladders and they're not going to be embarrassed.
Yeah. Yeah. It sounds like really learning to listen to your body and share these details with your doctors just really can help impact your quality of life, which
Mhm.
is so important.
Yes.
Yeah. Okay. So it seems like the VA has like a bowel and bladder program that falls under the Veterans Health Administration Spinal Cord Injury and Disorder Program Office. Can
Mhm.
you tell us a little bit about that program and how someone can qualify for that program?
Yes, so the VA medical centers have the authority, so to speak, to be able to help a person, a veteran designated caregiver, get involved in this program. And this is really operated under the Office for Integrated Veteran Care. And what it does, it supports veterans who are living in the community to be able to get bowel and bladder care performed by the person that designated to do that. It's a very personal thing, right? So they
Yeah.
designate whom they want to do it for them. And basically, what the VA will do, it will pay you that person an hourly rate. And the rate is basically, about what a VA employee would make, like a GS5, the salary of like a nursing assistant. And just to let you know, it will be taxed because it's income. Now, how it works is, that person, once that person is brought to the healthcare worker, and so this is the person who's going to be performing my bowel and bladder care. That person is then guided through the process. That person has to get a NPI number, which is a National Provider Identifier number that is unique to you. You go in to the online website of the National Plan and Provider Enumeration System. It's called NPPES. You go online and you apply for an NPI number that is assigned to you. So you get that NPI number, you let your VA medical center know you've gotten your number. Once you've gotten that number, then they will work with you for you to sign what's called a veteran care agreement that says, I am going to be the person that will be, trained to do this care for my loved one, the veteran. And that agreement, you sign it with them. It's every 3 years, it has to be renewed. And through that agreement, you will then be able to be paid. So they will teach you how you can submit your payment for the services that you're going to be rendering to your loved one. And it has to be submitted within 180 days of the care that you provide. So each time you provide that care, you can upload it every time, or you can do it in batch to upload your care. Now, I would say to veterans living with multiple sclerosis to let your caregivers know that if they have any questions that they feel they're not able to navigate themselves, they can always call the Paralyzed Veterans of America organization, because there is a service officer, they're well versed on this, and they can help you navigate this whole process.
Wow, that's really amazing that you can like get your caregivers, family members, or whatever involved in this because it is a personal thing. And it sounds like there's some really good training involved.
Mhm.
That's wonderful.
Mhm.
So, are there certain qualifications for someone to be able to qualify to participate in this program as a patient who's needing these services?
Okay, the patient or the designated caregivers?
The
The
patient.
veteran. Okay, so
Uh-huh.
basically the veteran who has MS, who is cared for by the VA, what they can do is they can speak to the healthcare workers and healthcare providers, who will then say, okay, if you're living in a community and you need this support,
Mhm.
okay, the VA will provide this support to you, but this person has to be trained. We bring that person in, we train them, we certify them, and then we get them through the paperwork, which is really online. And then they can be able to get paid for the service that they provided, but they have to be trained to verify that they know what they're doing and not cause more problems for the veterans.
Okay. Well, great. Well, wonderful. Well, thank you so much for sharing such valuable information today. You know, like as somebody living with MS, I've experienced bowel and bladder issues myself, and it's just so nice that we're talking about this topic. I think it's very important for people to kind of get rid of that taboo and just to really share, because it really can impact our quality of life. So as we close, what are your top 3 takeaways that our audience can begin to act on right away? Like, what are the highlights that you want them to like not forget?
Well, I tell you, the number one, pay attention to your body.
Mm-hmm.
Please pay attention to any changes in the function of your bladder or your bowel. I went through some signs, some things that you can see just to kind of, trigger you to know what to look for. But please pay attention to your body. Any changes that you're noticing, keep a diary, keep a log.
Yeah, that's a good idea.
So this way you cannot forget. And you can be able to speak to it. And the second thing is, after you see these changes, please, please, please speak to your healthcare team about it. Okay, don't wait till you have major issues. Make an appointment, please, and talk to them about these issues that you've seen, that you've kept a log of, right, in your diary. And then once you've discussed it with them, my third thing I want to emphasize is you will come up with a plan together. They will explain to you what's happening. They will identify the cause of your situation. They will tell whether it's an overactive bladder or a bladder that's not, emptying properly, or your bowels. Once you've identified which one it is, then they will come up with recommendations, and you both will come up with recommendations that you will agree upon implementing in your life. So I'm asking you to please follow those recommendations and give feedback in real time to your healthcare providers on how it's impacting your body, because you really want to address these things before you have serious complications.
Yeah. Such good points. Well, thanks again for sharing your expertise on this topic. And thanks for everyone who've submitted questions and comments below. I would like to remind everyone that you can connect with an MS navigator via phone, email, and through the Society's website via chat. For information and resources on MS, visit the Society's website. You'll find research updates and news, self-help groups just for veterans and active duty military, and more ways to get involved, and upcoming events near you. And you can connect with the National MS Society and others affected by MS via Facebook, Instagram, Twitch, Twitter, YouTube, and LinkedIn. I encourage you to like, subscribe, and or get on the Society's mailing list to continue to receive up-to-date information on MS, updates, and upcoming programs. I want to thank Dr. Gill again for sharing her knowledge and for everyone's engagement in today's program. The recording will be made available on the Society's website at www.nationalmssociety.org/MS expert. I want to invite you to join us in September for our next Ask an MS Expert Veterans program. Lastly, it is important to get your feedback on today's program. You will see a survey linked in the comment section or in the program description on Facebook, YouTube, and Twitch. Completing this survey makes a difference, and it only takes 1 minute to complete. The information you provide helps continuously improve and shape future segments. Thanks for joining us today, and we will see you soon.